The Case Files collection is produced by McGraw-Hill and is based on the Case Files book collections. Each collection contains between 30 and 60 cases. We can scroll across the banner at the top to see the various case collections, or we can make selections from the top menu bar. I'm going to select Basic Science Cases, and from here I'm going to select the Case Files Physiology collection. We see the cases by the title of the case, but we can change the view to case number. You may assign or be assigned a case by number. I'm going to go ahead and select Case 16. This is the case of a 24-year-old woman who delivers prematurely at 27 weeks. The baby shows signs of hypoxia and is intubated and given surfactant. The hypoxia resolves and the baby is transferred to the NICU. Below the case are 3 questions about the case, and you can show the answers to the case. There is an interactive option for all cases, but you need to set up your own account called a My Access profile under the library's license. This can be done by selecting the gray Sign In option in the upper left and then selecting the blue Create a Free My Access profile. Once you have an account set up, you can log in when you go into Case Files. Once logged in, you can see that the answers to the questions can be entered, and you can show and save your answers. Showing the answers also gives an explanation. At the top of the case, I'm going to next select the Approach section. This section provides very detailed information related to the case. Careful reading of the Approach section should assist you in answering the comprehension questions at the end of the case. There's also a selection on the menu bar for the case called Physiology Pearls. This provides concise points to remember related to the topic of the case. There's also references related to the case, and then the comprehension or quiz questions. You need to be logged in to your own My Access profile in order to see the comprehension questions. There are generally between 3 and 6 multiple choice questions for each case. I'm going to quickly answer the questions. I see that I've scored 33%, answering only one question correctly. Each question is listed showing the correct answer as well as my answer. There is then an explanation about that particular question and answer, along with the percentage of users who answered it correctly. And that's the percentage of all Case Files users, not just UNR Med. I'm going to go back to the top of the screen and I'm going to select Clinical Rotation Cases. This provides clinical rotation cases across specialties from anesthesiology to surgery. I'm going to select Case Files Pediatrics. Notice the table of contents on the left side. There is a section called How to Approach Clinical Problems. A similar section appears in each case collection. This section provides very useful information about cases and patients within this specialty. The list of cases defaults to showing the cases by topic. You can see that some are green with a check mark, some are purple, and most are blue. The green cases are ones that I have completed, the purple cases are ones I have started, and the blue are ones not yet viewed. To see everything I have done across all case collections, I can click on the My Case History at the top of the screen. This shows all of the cases I have either completed or started across all of the collections. Notice that there's an option on the menu bar for postgraduate cases. This includes case collections covering gynecologic surgery, orthopedic surgery, and high-risk obstetrics. All cases across all collections use the same format. On the main menu, there's also a selection for podcasts audio. A number of podcasts have been made specific to various cases within the collection. The podcasts discuss how to reason through a case and make decisions about next steps in diagnosis and treatment. This concludes the tutorial on the case files collection. If you have questions, please contact us at savit@med.unr.edu.